Hi class, today I'm going to discuss the importance of proper administration of PRN pain medications. PRN pain medications are administered on an as-needed basis when the patient indicates that they are experiencing pain. You are the nurse caring for a patient post-op a right hip arthroplasty and the patient indicates that they would like a pain pill. As the nurse caring for the patient, a proper pain assessment needs to be completed at the bedside in order to determine if a pain medication is indicated. Ask the patient to state their pain level at that current moment, and remember, pain is what the patient says it is, even if they are not in any observable pain. For the purpose of this discussion, the patient states a pain level of 7 out of 10. Next, ask the patient where their pain is located and have them describe the pain as much as possible. For example, is the pain dull, sharp, stabbing, aching, or crushing? Also ask the patient the duration and frequency of the pain and if the pain radiates to another part of the body. After you complete the assessment and determine that administration of a pain medication is indicated, document all of the assessment data appropriately in the patient's medical record. Check the medication record, or MAR, and verify the pain medication ordered. For this discussion, the patient has an order for hydrocodone with acetaminophen, 5/325 milligrams, 1 tab, Q4 hours, PO, PRN pain. Verify the time of the last dose given. The dose was given 5 hours ago, so it is appropriate to administer. If the medication was given less than 4 hours ago and the patient requires pain relief, the MD needs to be notified. If you have never administered this medication before, it is necessary and best practice that you research the medication prior to administration. This holds true with any medication that you have never administered before. You must know the action, intended uses, side effects, desired outcomes, and any associated lab values prior to administration. After you have familiarized yourself with the medication, begin your 3 checks using the 5 rights of medication administration: right patient, right medication, right dose, right time, and right route. There are additional nursing rights of medication administration that can include right assessment, which would be your pain assessment and the data that you collected prior to researching the medication, and the right reason, which would indicate that the patient is in pain and administration of pain medication is appropriate. Since this PRN medication contains acetaminophen, you must make sure that no other medications contain acetaminophen prior to administration and check for any contraindications or drug-to-drug interactions. Return to the patient's bedside and use 2 forms of identification. Name and date of birth are most common. You also want to complete patient education related to the medication at this time. You want to explain to the patient that this can cause nausea or vomiting and possibly dizziness, and indicate the proper nursing interventions that you would take with the patient, such as taking the medication with a snack and calling for assistance when they need to get out of bed. After the patient takes the medication, document as appropriate, and you want to reassess the patient's pain status in approximately 45 to 60 minutes, utilizing the same assessment procedure as earlier discussed. After you complete the follow-up pain assessment, document the findings in the patient's medical record. Remember, if it is not documented, it was not done. I hope you have found this information helpful, and please remember to use safety whenever administering PRN pain medications.